The Korle-Bu Teaching Hospital, Ghana's premier healthcare institution, stands at a critical juncture in its storied history. As the largest tertiary hospital in the country, it has long been the cornerstone of advanced medical care, providing a wide range of services to millions of Ghanaians and patients from across West Africa. However, like many public healthcare institutions, it faces significant challenges, particularly in the areas of infrastructure and service delivery. These challenges have prompted the hospital's management to take bold steps towards addressing gaps in clinical and surgical services, with the most recent initiative being the planned construction of a state-of-the-art endoscopy unit. The management of Korle-Bu has outlined an ambitious plan to secure $5 million from its suppliers to fund this critical project. This new endoscopy unit, once completed, is expected to significantly enhance the hospital's capacity to provide advanced diagnostic and therapeutic procedures. Endoscopy, a minimally invasive procedure that allows doctors to view the interior of a patient's body using an endoscope, is essential for diagnosing and treating a wide range of conditions, including gastrointestinal diseases, cancers, and other internal disorders. The addition of a dedicated unit for such procedures will undoubtedly augment the hospital's existing facilities and improve the overall quality of care provided to patients. The construction of the endoscopy unit, in particular, represents a significant investment in the future of healthcare in Ghana. Endoscopic procedures are becoming increasingly important in the early detection and treatment of diseases, and having a dedicated unit for such procedures will position Korle-Bu Teaching Hospital as a leader in this field. The new unit will not only enhance the hospital's capabilities, but also reduce the need for patients to seek these services outside the country, which can be both expensive and time-consuming. Quick reminder for those who haven't subscribed to our channel, please do so to stay updated on such insightful content and help us reach our goal of 30,000 subscribers by the end of this month. Your support means a lot. The decision to focus on building an endoscopy unit is a response to the growing demand for specialized medical services in Ghana. Over the years, Korle-Bu Teaching Hospital has seen an increase in the number of patients requiring complex diagnostic procedures. However, the hospital's current facilities have not kept pace with this demand, leading to delays in diagnosis and treatment. The gaps in clinical and surgical services have had a ripple effect on healthcare delivery, contributing to longer wait times, increased patient loads, and, in some cases, suboptimal outcomes. The new endoscopy unit is therefore not just an addition to the hospital's infrastructure. It is a crucial intervention aimed at bridging these gaps and ensuring that patients receive timely and effective care. Dr. Oku Ampoma, the chief executive of Korle-Bu Teaching Hospital, has been at the forefront of this initiative. His leadership has been characterized by a clear recognition of the challenges facing the hospital and a commitment to finding practical solutions. In announcing the plans for the endoscopy unit, Dr. Ampoma did not shy away from acknowledging the difficulties that the hospital has faced, particularly in terms of financial constraints and the need for improved service delivery. He noted that the project would also include the construction of a daycare unit, which is expected to cost an additional $700,000. This unit will further enhance the hospital's capacity to manage outpatient procedures, reducing the burden on inpatient services and allowing for more efficient use of resources. However, securing the necessary funding for these projects is no small feat. As a government entity, Korle-Bu Teaching Hospital operates within a complex financial framework that often involves delays in reimbursement for services rendered. Suppliers who play a crucial role in the hospital's operations by providing medical supplies and equipment have at times expressed concerns over these delays. Such delays can strain relationships and create uncertainty, which in turn can affect the timely delivery of critical supplies. Dr. Ampoma has acknowledged these concerns, noting that while the hospital has made progress in improving its payment processes, there is still work to be done. The current system allows for a 90-day period within which payments are to be made, a standard practice for many public institutions. However, this delay can be challenging for suppliers who rely on timely payments to sustain their businesses. Dr. Ampoma has emphasized the importance of prompt communication with suppliers to manage expectations and navigate any challenges that may arise. By fostering open lines of communication, the hospital aims to build a more collaborative relationship with its suppliers, like ensuring that both parties can work together to overcome any difficulties. In recent years, Korle-Bu Teaching Hospital has made significant strides in improving its payment processes. Dr. Mpoma highlighted that the hospital's status in terms of payments has improved, but he was candid in admitting that more needs to be done. The goal is to streamline internal processes to the point where suppliers do not have to physically follow up on their payments. This would not only improve efficiency, but also reduce the administrative burden on both the hospital and its suppliers. Such improvements are critical in maintaining the trust and cooperation of suppliers, who are essential partners in the hospital's operations. In addition to the endoscopy and daycare units, Korle-Bu Teaching Hospital is also taking steps to enhance other aspects of its service delivery. One such initiative is the planned construction of a 24-hour pharmacy. This development is expected to address one of the long-standing challenges faced by patients: access to medication at all hours. The current system, where pharmacies may have limited operating hours, often forces patients to seek medications from external sources, which can be both inconvenient and costly. A 24-hour pharmacy within the hospital will ensure that patients can obtain the medications they need without delay, thus improving the continuity of care. The importance of these initiatives cannot be overstated. Korle-Bu Teaching Hospital is not just a healthcare facility. It is a symbol of Ghana's commitment to providing high-quality medical care to its citizens. The challenges it faces are reflective of the broader issues within the public healthcare system, issues that require concerted efforts and innovative solutions. The planned endoscopy unit, daycare unit, and 24-hour pharmacy are all part of a broader strategy to modernize the hospital's infrastructure and improve service delivery. However, the success of these projects will depend on more than just financial resources. It will require effective management, stakeholder engagement, and a commitment to continuous improvement. Dr. Ampoma and his team have shown that they are willing to take the necessary steps to address the challenges facing the hospital, but they will need the support of all stakeholders, including the government, suppliers, and the wider community. Moreover, the daycare unit will provide much-needed relief for the hospital's inpatient services, allowing for more efficient use of resources and reducing the strain on the hospital's capacity. This is particularly important in a context where healthcare facilities are often overstretched, and there is a need to optimize the use of available resources. The planned 24-hour pharmacy is another critical component of this strategy. Access to medication is a fundamental aspect of healthcare, and the ability to obtain necessary drugs at any time of the day is essential for patient care. By ensuring that the hospital's pharmacy is operational around the clock, Korle-Bu Teaching Hospital is taking a significant step towards improving patient outcomes and enhancing the overall patient experience. In conclusion, the planned developments at Korle-Bu Teaching Hospital represent a bold and necessary response to the challenges facing Ghana's healthcare system. The construction of a new endoscopy unit, daycare unit, and 24-hour pharmacy are all part of a broader effort to modernize the hospital's infrastructure and improve service delivery. These initiatives, while ambitious, are critical to ensuring that the hospital can continue to provide high-quality care to the millions of patients who rely on its services. However, their success will depend on effective management, stakeholder engagement, and a commitment to continuous improvement. With the right support and resources, Korle-Bu Teaching Hospital has the potential to not only overcome its current challenges, but also to set a new standard for healthcare in Ghana and beyond.
If today is your first time watching this channel or you are returning to this channel for the exciting content, please subscribe to the channel for more educative and developmental projects across Ghana and Africa as a whole. Do you want to know about the state of a project in Africa? Then make sure to like and comment the name of the project you would like us to talk about and its current state.